Department of Military and Veterans Affairs would like to welcome you to this discussion with Miss Allie Petracci, speech-language pathologist at the Veterans Memorial Home in Vineland. Ms. Petracci discusses exactly what a speech-language pathologist does, the technologies that she utilizes, and her interactions with the residents and her colleagues every day. Welcome, Ms. Petracci, and thank you for spending some time with us today. First of all, can you tell us what a speech pathologist does?
So at the building, I work in the rehab department. I do speech therapy. I'm a speech therapist, so that kind of includes cognitive therapy. So anybody with a dementia diagnosis, anybody who has various diagnoses that would affect anything with the mind, just general aging. I do cognitive therapy, so I work on their safety awareness. I work on their memory. I work on their ability to problem solve and make good decisions. I work on their orientation, so it kind of varies depending on the severity of the person. And then I do dysphagia therapy, so swallowing therapy. So anybody who has trouble chewing their foods, anybody who has trouble swallowing their foods, kind of anything in between, I work on that and assess their diet and kind of recommend what would be safest for them, what they're able to tolerate, things like that. And then I also do speech and language therapy. So someone who may have had a stroke and kind of has trouble verbally expressing themselves, or somebody with Parkinson's who kind of develops more trouble expressing themselves, things like that.
So there's a lot more to speech therapy than just talking and
yes.
assisting with speech then.
Yeah, the name's a little bit deceptive. I think people don't really realize all that falls under that umbrella.
So for speech therapy in particular, what are some of the tools or techniques or things like that you use to, I guess, treat? Treat,
yep. So in this building, if someone has, let's say they have severe MS, so something a little bit different. They lose their ability eventually to use their voice to produce language. But in their mind, they know exactly what they might want to say. They still have wants and needs that they need to let us know. We're really, really lucky in this facility and in the VAs in general. We have access to the latest technology, so we actually have used, it looks almost like an iPad that they put in front of someone, and if they're no longer able to, communicate using their voice and using their mouth and all of that due to muscle issues and things, they can use eye gaze to communicate. So they're able to look at a screen that we program and place in front of them, and there's a tracker in there that follows their eyes, and wherever they look is what the machine will say. And we can program anything in the world for them to be able to say, anything that they want, anything they need. They can go on Facebook with it, they can use the call bell with it, anything. So we've been able to use that with a couple people here, and we're trying to kind of roll it out more as we need, but that's a really cool piece of equipment that we're able to use. It's really, really cool.
That's like movie, like Star Trek stuff.
Yeah, so that's one of the more exciting things that we use. I use a lot of picture cards, so showing someone a picture of something and saying, there's something not safe in the photo, and saying, okay, what is not safe about this picture? And so if they're able to identify, oh, it's not safe that they're not using their walker in this picture. Okay, why should they use their walker? And then the patient's able to say, oh, so that they don't fall. Then I turn around and say, okay, well, you weren't using your walker, so how can we make sure that you use your walker to not fall? Things like that.
It seems like there's very an individualistic approach to...
Very much so. Every single person is different. Everybody has different needs, and that's kind of the fun thing about the job is it's not cookie cutter. It's I'm sitting with a person, so what does this person need? What does this individual need? And that's even more so when it comes to the swallowing aspect of things. Everybody's able to tolerate different things. So we're really lucky in this facility that it's called cross texture. We're allowed to cross texture. So what you and I would be eating is usually regular food, right? That's considered a regular diet. We don't need it to be cut up really small. We don't need it to be covered in gravy, anything like that. But a lot of our residents, due to either diseases, due to normal aging, due to loss of dentition, some people won't wear their dentures don't fit, they don't like the way they feel, whatever it is, it affects your ability to chew and swallow your food safely, right? So we're very lucky here that when I go in and I might say, okay, John Smith, you're not able to chew a steak anymore, but we're able to put you on, we call it chopped. We're able to put you on a chopped diet where the steak will have extra gravy on it. It'll be cut up by our staff, and then you're able to safely consume it. So we're really lucky in the sense that the facility really works with us in letting me make decisions that are the best for the patient, and then they're really great at being lenient and following those, we call them orders, the orders that are written.
So it's communication, right? Up and down. All the way to the
Absolutely.
kitchen.
Yep.
Kitchen staff all the way to the...
Yep, the activity staff that walks around in the dining room, they'll be educated on what the appropriate texture is for that person and how it should be coming out. So there are checks and balances. So there are an extra set of eyes that get to make sure that the meal that comes out and is put in front of somebody is what's deemed appropriate for them. They're able to go over and maybe cue a patient if they need some cueing every once in a while to say, oh, keep eating your food. Some of our people, especially in the dining room, it's very exciting in there. There's a lot of commotion. Those sometimes get a little bit distracted and the socialization becomes the main focus and not necessarily the eating, which is a great thing in some ways, but our staff's great at going over and saying, oh, you know, take another bite. And again, all those things kind of trickle down from what we see in therapy and what we see that that person needs. We kind of create a treatment plan and an overall plan with the staff to how to carry all that out.
For the care of one individual patient, how many people do you think, like, you would estimate are on a team? There's like you,
A ton.
LNs and CNAs and RNs
Yep.
and doctors and kitchen staff and down to the person that changes the roll in the restroom. I mean,
Yeah, it is a whole team. So there's the dietitians are very heavily involved. The kitchen staff is heavily involved. We have diet clerks that make sure that the tickets are correct so that people are getting what they're recommended. The CNAs on the unit, when they pass out the trays, they double check and set everybody up, and sometimes they'll have an order for them to cut the food or do whatever. So they're very heavily involved. We have informatics nurses that make sure that whatever I'm recommending gets appropriately put in the computer and then signed off by the physician. So the physician's heavily involved. It's really across the board. Everybody kind of plays a really important role. Like I said, the activity staff or companions are sometimes assigned to say, keep eating and encourage them, things like that. So it really is the entire team is having a role in this.
So I want to rewind to what you spoke about earlier, the eye gaze and some of the modern technology. Can you talk to me particularly about eye gaze and some of the other tech that you use to assist the residents in the home?
Exciting, like that's the fan favorite, right? It's pretty much as cool as it gets. We also are really, really lucky that we have access to different video swallow applications, I guess you could say. So there's two different types that we can do. One is called, let me rewind. So basically, if somebody's having trouble swallowing, I'll go in and I will sit with them during their meal and see what I can see with my own eyes, right? So I'm trained on different signs and symptoms to look for and different things that would tell me something might be going wrong, to keep it simple. If I'm seeing something or if there might be a problem, say the person keeps getting pneumonia when they're eating, and I'm not seeing that there's a problem, but there might be something happening silently, we call it, we're able to send them to any facility we want. We can have people come in, we have any option that we want to get what's called a swallow study done. So they either go to a different facility that we recommend and they will sit in it's like a big x-ray room, and they'll feed them different foods that we've asked them to look at, and they're able to see through the x-ray machine if things are going down the right pipe or not, to put it in normal terms. So then based on that, we're able to say, okay, this person can tolerate XYZ diet, whatever, and it's a little bit foolproof. It's like the gold standard. So us having access to that allows us to make sure that whatever we're recommending is what is the safest at that time. We also have access to have people come into our facility from the outside. They bring a fiber optic camera that goes down someone's nose into their throat. It's not painful, it's a little bit uncomfortable, but it's not painful. And we're able to feed them and watch them swallow live to make sure that the food, again, is going down the right pipe. So it's really cool. And I've worked other places and other things, you don't have access to that. It's just, doctors won't sign off on it. It's very expensive. It's very labor intensive, all of that. So we're really, really lucky here that we're able to, any problem that I see, any testing that we want, we're able to get done. And it's very timely. It's really a blessing.
Do you feel you have all the support you need, technology-wise and personnel-wise, to assist all the residents at all times?
Yeah, from my perspective, anything that we think is is needed for our veterans here, we have been able to get our hands on. It is, from my experience as a speech therapist, we have been very, very lucky. Anytime, even if somebody is having more trouble communicating verbally, again, could be due to a disease, could be due to dementia, could be a multitude of different things. Even if the eye gaze isn't necessarily appropriate, that one where they're looking, we can send them to the other VA and they'll assess them for it's basically an iPad for argument's sake. It's an iPad where they're able to touch things and communicate. We call it AAC. So they're able to use that, and then they come back here and I can train them so that they never, my goal is I don't want anyone to lose their ability to communicate. Whether that be, as little as being able to look at their loved one and indicate that they love them, or say, thank you, or tell the staff I'm hungry, or, I need to use the bathroom, or I'm wet, or whatever that is. It's really, really important to me that people are able to communicate what they need. And the VA does a great job at kind of giving me any apparatus I could possibly need to make sure that that is able to happen.
How nice is it within the home to have the support from the administrative staff, technology-wise, personnel-wise, all the things we just talked about? From a nursing standpoint, how important is that?
Absolutely, it's huge. It's nice knowing I'm up against enough anyway, right? With every patient, there's personalities, there's family members, there's, they don't want to do therapy. They don't feel like it today, or that, there's the normal things that you're up against. It's nice to not have to worry about being up against getting what I need. For example, if someone needs diet modification and they are on thickened liquids. So sometimes we'll thicken someone's liquids in order to just increase the viscosity to decrease the rate that it's falling down the throat, to keep things simple. The VA has pre-mixed ones. So the staff is not having to go in and use the pump and try to make sure that it's standardized, to make sure it's thick enough that the person's gonna be safe. They order them pre-made, everything is standardized, there's no, human error in it, so I can be sure that if I recommend something, that is what the person is going to get. There's no issues, yeah. But that is very nice in and of itself, because in other facilities, I think trying to get staff to kind of go the extra mile and make sure that they're doing exactly what's recommended is hit or miss depending where you're at and who you're working with. So it's really nice that here we can almost guarantee that if something is recommended, it's going to be carried out by our staff. They really care. They really know the residents. They really are great at communicating. I always say,
I know you mentioned efficiently. That's important
yes,
too, yeah.
They are my eyes and ears on the unit at all times. I can only be with so many people at so many meals. So especially the CNAs, they're always coming to me, hey, so-and-so, I noticed that they've been coughing a little bit more. Is there anything that we can do? So then I know, okay, I'm gonna go in and check on that person and make sure that they're still tolerating their diet. The CNAs they're the backbone of the building, for sure.
What are some of the challenges and rewards with working with the veterans?
So working here's the best because I get to work with the coolest population of people. We get to work with the veterans. I get to interact every single day with people who may have served in World War II, across the board. It's a very, very unique experience, and it's very, very cool. Because of that, you get varying levels of, some people are declining, and that's really hard to watch. And I kind of try to go in and be a support to the families and kind of tell them, hey, they're declining in their swallow, but I know that they might really love your homemade soup. If you want to bring the soup in, I would love to sit with you and make sure that they're safe while they swallow it, things like that. So trying to just make the end a little bit easier for the person and for the family, and kind of maintaining their dignity as much as we can. That's really, really important to me. I also make a lot of great relationships where, we have some characters here. We have a lot of big personalities with some of our patients, which is awesome. They make me laugh all day long. I have one who comes and sits in front of my desk every single day while I type my notes, and he'll sing and carry on. And we found out that he grew up on the same street that I live on, ironically. So you get to make a lot of really cool relationships through the process of, working with people, or even just walking through the hallways here. When you've been here long enough, you get to know everybody, whether they've had speech services or not. You just familiarize yourself with every person. So That can be really cool. Again, there's the heartbreak that comes because you do inevitably watch most people decline, and you see them on their way out, but it's nice knowing that when we do get to go talk to the families, or when they have declined or they have moved on, like, we're able to go talk to the families and say, oh, I had such good memories with your father, and he was so funny, and he told me this or he told me that story. And I think that really brings comfort to the families to know that, like, they were loved in their last couple years, and we look out for them here, and we really get to know them as much as we can.
How do you feel about the facility as a whole?
This building is one of a kind. It is like no other. There's a bowling alley, we have a movie theater, there are activities constantly. Like, it's hard for me to get my patients to work with me because they want to go to an activity, which is amazing. I love that they're so social here. There's people performing all the time. There's singers that come in. They have bingo. Bingo's a big thing. You can't mess with bingo. There's pizza parties and ice cream trucks that come, and they had a dunk tank last year that they were able to throw the ball and dunk the CEO or dunk the kitchen staff or whoever volunteered. They really try and make it a very social environment. They try to, maintain people's dignity. A lot of people are able to use power chairs to kind of get where they need to go, which gives another level of independence that's awesome. The building itself is immaculate. It is the cleanest place I've ever worked. They're always upgrading something, or they just built a new courtyard out front. They're always doing any upgrades that they could possibly do. Everything's always immaculate, always.
What do you see for the future for yourself as in the medical profession?
Yeah, I'm happy where I'm at right now. I bother my boss with this all the time. I'm always looking for opportunities to grow and let me go do this, let me go take this course, or let me, go talk to so-and-so or cover at another building, things like that. I've taken students. I would like to continue to take students and kind of help progress the profession in that way by kind of paying it forward and showing them what I know, and I've learned from them. The student that I had in the spring, I learned a ton from her, just different universities doing different things. I'd love to eventually adjunct professor somewhere and kind of get into the education side of things. That would be cool.
Do you have a personal story or experience, anecdote with a resident or family that you would like to share?
I had one family a while ago. The patient had been here for a very, very long time, and she was pretty steadily declining over the last year or so. The family was very, very kind, very sweet to all of us, but we had a little bit of, she wasn't able to swallow certain textures, and the family would kind of consistently be bringing in things that were just not appropriate, and it was always the worst things you can think of, right? So if she's supposed to eat foods that's like the consistency of like an applesauce, they'd bring in like a York peppermint patty, or, the things that like I have nightmares about. But they were so kind, and they were so sweet, and they were so understanding. And I learned a lot from them in the sense of, my job is to look out for the patient's safety first and foremost. I always want them to be safe first, and then I look at quality of life as a very, very quick second. But to me, if you're, put in an unsafe situation where there's a possibility of choking, or there's a possibility of pneumonia, that's not gonna be a good quality of life. So I try to make sure that the families know that. This family in particular, they were very, very sweet and very kind, and they didn't always follow my recommendations, but they taught me a lot about seeing the other side of things, where they're seeing their mom or their grandmother or their loved one. They're watching that decline, and they've known this person for their whole life, and they saw them when they were youthful and things like that, and to them, this person is who they've always known them to be, and this person is, they loved the peppermint patties or whatever it was. So they taught me a lot about kind of making sure that I always see the other side of the story and see where the family's coming from, because it's easy in my shoes to just look at, well, this is what they need, this is what is safe. So they taught me a lot about seeing the other half of things.
Do you have any advice for aspiring medical professionals or people specifically considering becoming speech pathologists? Possible hurdles, challenges, advantages, things of that nature? I
would say do it. Without a doubt, do it. It is the most rewarding It is the most fulfilling job that I can think of. Obviously, I'm a little bit biased, but every day you get to go to work with the possibility of helping someone. Now, does that happen every day? No. But we have the potential to affect a life every single day, whether that's as simple as, getting so-and-so to be able to say, I need to get changed, I need to be changed. That positively impacted their quality of life on that day. And it doesn't always feel like a victory, and sometimes it's easy to see the mountain of, oh my goodness, but they can't say all these other things, or whatever it is, or they can't eat this, and I'm so sad that they can't eat this. But it really is, you have the possibility to make someone's day every single day. And I think that most professions, you don't get that. It comes with a lot of hurdles. You give the bad news a lot of times. You tell people, I know that you love pizza, but you can't swallow pizza anymore. So you eating pizza is not gonna happen here. That can be really, really hard, and people get very angry with me and they get frustrated and I become the bad guy. But overall, I think that eventually most of my patients have kind of come around and realized, okay, she's not the bad guy. I always tell them, I am your teammate. We are on the same team here. It doesn't feel like it all the time, but we are on the same team. I want what's best for you. I want you to be happy and healthy and safe. And I think that most of the time they end up realizing that. Like I said, they get mad at me in the meantime when I'm restricting them sometimes for their own safety, but it's overall very rewarding.
When it became time to choose a location to start your career, did you make a conscious effort to seek out the veterans' homes?
That was the biggest draw ever. That is, working for this building in particular is like a dream position in the speech world. This is, again, you have every resource you could ever want. You work with the coolest population of people, in my opinion, people that you would never have access to out in the community or in the private sector or anything like that. So again, it is a dream job.
That was speech language pathologist Allie Petracci at the Veterans Memorial Home in Vineland. On behalf of the New Jersey Department of Military and Veterans Affairs, we thank you for listening.